is Ontario making any progress flattening the curve of this second wave? With so many changes in testing criteria and volumes in recent weeks, it's becoming increasingly difficult to know exactly where the province currently stands in this ongoing battle, or whether further steps need to be taken. Here's what we do know. 841 new infections are being reported. That's the second highest number we've seen so far during this pandemic. The rolling 5-day average is now 763, up by just over 20 from this time a week ago. We're also keeping a close eye on the mounting death toll, which rose by 9 for a second straight day. And here's one trend that continues. 80% of the new cases are coming from just 4 regions: Toronto, Peel, York, and Ottawa. Nearly 39,000 tests were processed yesterday, and that number is slowly climbing back up from just a couple of days ago when only 24,000 were completed. So the number of tests completed every day continues to fluctuate, and so does the positivity rate. Today it sits around 2.2% overall across the province, but that figure is much higher here in Toronto, where 4.4% of tests have come back positive over the past week. Ontario's health minister says she's watching the situation in our city closely and will not rule out putting more restrictions in place.
It's concerning for all of us. I know it's very concerning to Dr. Davila, and it's concerning to Dr. Williams and the whole public health measures table. But we're looking to see what action the measures that we put in place are going to have. It is going to be a bit delayed in terms of putting the measures in place and then seeing what effect they have. If we need to take further measures, of course, we will do so.
It was 12 days ago that the government shut down indoor dining, gyms and theatres in Toronto, Peel and Ottawa. That modified Stage 2 period was supposed to last for at least 28 days. So have those measures had any impact? Well, health officials claim the restrictions have stopped case counts from growing exponentially. The province's top doctor also says infection numbers appear to be dropping in Ottawa, but that it's still too soon to tell whether the same thing will happen here in the GTA.
It's only just a short look. I'd like to be encouraged by that, but we still have to see how it goes in the long run. And so we have a number of days to go. That's why we said we want to do it for 28 days, knowing that we would doubt we would not see a full impact or much impact in the first 14.
I wish I had a crystal ball to find out where we're going. You know, I pray in a couple of weeks things are going to change. I pray every day that the numbers are going down. The more we all work together, we follow the guidelines and the protocols, we'll be able to get through this.
There is one new development on the testing front. 100,000 of those new rapid tests that were recently approved by Health Canada have arrived here in Ontario. Health Minister Christine Elliott says they'll initially be deployed to long-term care settings and rural areas where there's very little access to standard lab facilities.